Do you know what an insurance premium is? What about a deductible? Do you know the difference between copay and coinsurance? If you're already lost, this episode is for you. Hi, I'm Ben. Welcome back to our series on health insurance for LGBTQ folks. In our last episode, we talked about all the different ways that people in the United States get access to health insurance. We talked about how employer-sponsored coverage is the most common, as well as how marketplace coverage is available to anyone who can't get insurance through other means. In future episodes, we're going to be looking at finding the plan that works for you, accessing care, and getting coverage for gender-affirming care. But before we can do that, we need to understand all the costs associated with health insurance and healthcare, so that you can pick a plan that best fits your budget. So in this episode, we'll go over how to pay your insurance premium and how to understand all the different numbers that you'll see on a bill when you get healthcare. Let's get into it. First, I want to talk about premiums. Premiums are the monthly cost of health insurance. You can think about this like a subscription fee because it basically is. If you fail to pay your premium, you may lose access to your health insurance through the rest of the year, but insurers are required to give you a 90-day grace period. Many insurers have auto-pay availability, and I do recommend setting this up so you don't have to worry about forgetting to pay your bill. Now, you may feel like premiums go up every year, and in part they do. This is because you're a year older. Partially, insurance premiums are based on your age, so it makes sense that the cost would go up slightly every year. But hopefully, the availability of financial assistance is also going up to keep step. In years previous, financial assistance has been widely available to help make coverage available for everyone. This is something called the premium tax credit, and we talked about this in our episode last week, so I'll let Ben from last week handle that. When you enroll in health insurance, the marketplace application is going to ask you for your estimated income for the year. And this is so that they can provide you what's called premium tax credits. Now, there are two ways to do this. First, you can agree to have this tax credit taken out of your monthly premium, so you'll pay a cheaper monthly premium, and then at the end of the year, based on your actual income, you may owe a little bit or get a little bit extra back if the premium amount that you paid was still too high. The other way to do this is to not take it out during the year, and then at the end of the year, you'll just get a huge chunk back as a premium tax credit. And this is why when you submit your taxes at the end of the year, you will also submit a document from the marketplace showing how much you paid every month as your monthly premium. Okay, so who are these tax credits actually available to? Well, they're available to anyone making up to 400% of the federal poverty line. For 2025 in the contiguous United States, that comes out to just over $62,000 for an individual or over $128,000 for a family of four. And this is on a sliding scale for whatever family size, whatever your income is, it will be calculated as long as that income is under 400% of the federal poverty line. So this means that these tax credits are actually pretty widely available. So when you fill out the marketplace application form, go ahead and list your estimated income for the year, and you should be able to see right there what your estimated premium tax credit will be and how much your monthly premium will actually cost you every month for the rest of the year. And go ahead and make sure to hit OK on getting that Medicaid check, so that way if you actually qualify for Medicaid, you can be informed automatically without going through a separate process. So now that you're enrolled in a plan and you're paying your premium every month, if you don't access care or you only access preventive care that's covered under the ACA, you shouldn't have any other expenses throughout the year. If you do access care, you'll get something called an explanation of benefits, which will have some terms that we'll get into now so you can really understand what everything means. So there are basically three tiers that dictate how much you pay versus how much your insurance company pays, depending on how far along you are through these expenses. The first is the deductible, and then there's a cost sharing period, and then there's after you meet your out-of-pocket maximum. In general, before you meet your deductible, you may pay all expenses. So in the United States, the average deductible is about $2,000 for employer-sponsored plans. It varies significantly for marketplace plans based on metal levels, which we'll get into in the next episode. So let's stick with the $2,000 for now. Every time you go to a doctor, to the hospital, get tests done, you might pay the entire cost of those services until you reach this deductible. It's possible that you won't pay all of this. You might go directly into cost sharing, and you can figure that out based on the summary of benefits and coverage. It'll say something like, after deductibles met, or deductible does not apply, and this will give you a better idea of how much these things cost from the get-go. But once you reach your deductible, you'll go into this cost sharing period where the copay and the coinsurance are what you pay every time. So a copay is a flat fee. This is set up for specific services. So it might be cheaper for your primary care doctor, say $20, $35. It might be more expensive, $40 to $60 for a specialist, and maybe more expensive, $80 to $100 for imaging or some other tests. Again, it'll say on your summary of benefits and coverage, so we'll see some of those examples in a minute. Then there's also coinsurance, and this is going to be a percentage of how much the total cost of service is. This, again, might be 10 to 20% for a primary care doctor, 20 to 40% for a specialist, and it goes up from there. So there's not as much of a perfect way to figure out how much something is going to cost if it's based on coinsurance. However, hospitals and doctors are required to have transparent pricing, so you can always go on the website and get an idea of how much something is going to cost based on how much it costs for them to provide the service and then your insurance company's coinsurance. In general, copays tend to be a little cheaper, and it also depends if it's a copay or a coinsurance, usually on whether or not it's in or out of network. Out of network is if you go to a doctor that your insurance company doesn't have a pre-existing relationship with, say if you're traveling and you're out of state, or if you go see a specialist to get a second opinion, it might be out of network. In a lot of cases, insurance plans have coinsurance for out of network and then copays for in-network coverage. Now, say you have a lot of expenses throughout the year and you reach what's called your out-of-pocket maximum. There is a cap on how high this could be. It's just over $9,000 this year, but in general, a lot of plans will have something slightly lower, $6,000 to $8,000. If you reach your maximum out-of-pocket, you should not have any expenses for the rest of the year. This will include copays, coinsurance will be free for you. The idea of a maximum out-of-pocket is that you won't have any other expenses. So you can get a sense based on your monthly premium plus the maximum out of pocket, how much in total you might have to pay if you have a lot of healthcare needs in a calendar year. This is also a number that you can see right away as you're searching for plans on healthcare.gov. Now, one thing to keep in mind is that this might not be the whole story. So in general, there tend to be different maximum out of pockets for in-network and out-of-network. If you're part of a family plan, there are also different numbers here for yourself and then your whole family plan. So you and your spouse might have different individual deductibles and out-of-pockets to get to. But if your spouse has a lot of expenses, then eventually your family out-of-pocket will be covered and then you won't have any more expenses. Finally, a lot of plans also have a separate drug deductible. This might be $200 to $500. And once you reach that, you won't have to pay for your prescriptions anymore for the rest of the calendar year. And that deductible is generally separate from your other plan deductible. So now I want to take you through a couple summaries of benefits and coverage so that you can understand what they mean. Luckily, under the Affordable Care Act, these have to be pretty standardized. So once you've seen one, you should have a pretty good idea of how to find the information you need in whatever plan you're looking at. So first I want to look at this silver plan by Blue Cross Blue Shield of North Carolina. So we can see here at the top that this is a point of service plan, and I'll get into that more in our next episode. Coming right down here, you can see right away what the deductible and the out-of-pocket limits are. So the deductible for this plan is $5,000 for an individual, $25,000 if you're out of network. That's pretty steep. $8,000 out-of-pocket maximum if you are in network, and no out-of-pocket maximum if you're out of network. And you can see here, premiums do not count toward your out-of-pocket maximum. So that's why I said that you have to add up your premium plus your out-of-pocket maximum to get the total number of how much you might pay for healthcare in a year. So coming down here, you can see some basic services and the cost for those. In-network primary care's $40 copay. So every time you go see your doctor, your primary care doctor, it's going to be $40. That's not going to change until you reach your out-of-pocket maximum. Specialist visit for this plan is $80. And then you can see here that both of these are 70% coinsurance after you reach your deductible for out of network. So that means that you're paying the full 100% if they're out of network. You reach your deductible, and then in that cost sharing phase, you're still paying 70%. Now in here you can see that the testing is listed as after deductible. So that means that it's going to be full cost before you reach your deductible, and then 40%. These both have coinsurance in and out of network. You can see here that drugs have specific copays as well, but there's not a separate drug deductible for this plan. You can see the costs that you might have if you have to have surgery or if you have emergency care. Now you can note here that these are the same price for in and out of network. That's because there's a requirement in the ACA that any emergency services be billed as if they're in network. So this is the one place that you'll see that there's no difference between the out of network and in network costs. Coming down to the bottom of the summary of benefits and coverage here, something also important to note is the excluded services. This will tell you what they don't cover under any circumstances. There's no chance that you're going to get coverage for this. And that's really helpful to see if you have a specific service or care that you're looking to get done. Like if you really want acupuncture, you can see that this plan isn't going to cover it. So maybe look for a different plan if you don't want to pay all of those costs out of pocket. The next plan I want to look at here is a plan by Oscar Health Insurance out of Texas. This plan is an HMO, which means that there's going to be very limited coverage out of network. You can see in fact here that most of these services are not covered at all if you're not in network. Of course, as I mentioned, the emergency care is still going to be covered as if it were in network, but everything else here, you really have to be in network with a provider that the insurance company has worked with if you want any coverage of healthcare. So this plan has a $5,750 deductible for an individual, $11,500 for a family. You can see that there's no other deductible for pharmacy coverage. And then the out-of-pocket maximum is almost $9,000 for an individual, almost $18,000 for a family. So this plan has a very low copay for primary care, which is nice. There is no charge for preventive services. That's a requirement by the ACA, so you'll see that in all plans. And then coinsurance for the diagnostic testing and imaging here. And again, you would have to go on the website of the provider that you're looking at to get a sense of how much it costs, and then do a little math to figure out how much your coinsurance is going to cost. And then scrolling down here, you can see the excluded coverages and some other coverage limitations. And we'll get into that more in a future episode when we go through the plan contracts themselves. Finally, let's look at this plan out of Ohio. This is by Aetna CVS Health. You can see that this plan actually has an overall deductible of $0. That means that you're immediately going into cost sharing. So there's not going to be any time at the beginning where you pay 100% of costs, unless, of course, something that you're trying to get is not covered by the health insurance company at all. You do see here that there is a separate drug deductible, so that's $2,000 for an individual in network, and that means that you can scroll down and see that there are specific costs here for prescription drugs, and it says after drug deductible is met. So I hope that brief tour of some example summaries of benefits and coverage gave you a little bit of a footing for when you have to go in and see how much it's going to cost you to go to the doctor, get tests done, pick up your prescriptions, whatever it is. So now I just want to turn real quick back to the explanation of benefits that we looked at in a previous episode so that we can see the other terms that we've talked about this week listed in here. So last time we looked at this, we were talking about negotiated rates and the amount allowed that the insurance company has decided your provider can charge. Now, if we come over to the right a little bit more, you can see your responsibility based on if you've met your deductible, or not, and then based on the copay and coinsurance amounts for each specific item. So you can see in this example that this person has $250 left on their deductible, and then the emergency service goes into the coinsurance after the deductible has been met. And then there's also a column here for amount not covered. In general, this is going to be an amount that no one pays. As I talked about with negotiated rates, this is usually just a waived fee. You can see over here in the example that it says that this is not owed by you and is not a bill. Every time you get an explanation of benefits, it has a bunch of extra numbers, and they always say this is not a bill for exactly this reason. So you can get an idea of how much you'll have to pay based on the copay coinsurance amounts, but there might also be other numbers in here, and you sort of have to wait until your actual medical bill gets sent to you and try to make these numbers match. If you're confused about these, which I often am, go ahead and call your insurance company and they'll explain all of it to you. Another great place to look is if you have a portal, because that'll tell you how far you are to meeting your deductible and then what other expenses you can expect in the future. All right, I hope this wasn't too hard to follow. As I said, if you have questions, the best way to get them answered is to go ahead and call your insurance company directly and talk to claims, member services, something like that. Now that we have a good handle on these terms, in the next episode, we're going to be looking at the marketplace directly and see how we can compare different plans and the costs associated to find one that fits your budget. Thanks so much for watching. See you next week.